My name is Matt, here with Professor Owen's Adult Health 1 class. We're going to be hanging a mini bag today, so we're just going to go through that, show you how to do it. So I'm going to look at the doctor's orders, looking at the MAR. He's ordered 1 gram of Rocephin. We have available Rocephin in 500 milligrams per ml, so that's going to be 2 mLs we have to administer to the patient. So what I'm going to do is go ahead and draw up my medication. I'm going to alcohol the top of the Rocephin bottle, pull back 2 mL of air, draw up 2. Alright, there we go. I'm going to get my mini bag. I'm also going to alcohol that. Wiping that. Going to administer the medication in here. Then I'm going to mix the bag up, making sure not to create any excessive air bubbles or anything. And then I'm going to hang my bag. I'm going to have the medication card available. I'm putting in the patient's name, the drug that I place in the bag, the amount, the time and the date, the expected expiration date on the tubing in the bag. I'm going to tape that to the bag. And then what I'm going to do is I'm going to prime the tubing here. Let's take this out. Careful when I'm doing this. Also make sure that the clamp is clamped all the way. So I'm going to prime the tubing here. I would unclamp this slowly to let the meds run. Alright, so clamp that off completely. And then what I'm going to do is I'm going to draw up my normal saline. Alright, 6 mLs, normal saline. Alright, so at this point I'm going to walk into the patient's room. I'm going to see if he has any allergies to penicillin or any dairy products. He doesn't. I wash my hands, put my gloves on. We're going to give this to him for pneumonia. Rocephin is for respiratory tract infections, urinary tract infections, and skin infections. So when I get into the room, I'm going to introduce myself, identify the patient, 2 identifiers. I'm going to check the IV site for any kind of phlebitis or infiltration from a previous med. Again, I would double check the MAR. So I'm looking, the medication has to be administered over 30 minutes. So we don't want to go in too fast or too slow. So then what I'm going to do is I'm going to check the patency of the patient's IV. So I'm going to alcohol wipe the port here. I'm going to put on my flush, unclamp the IV tubing. I'm going to pull back for a little blood return, and then I'm going to flush using a start-stop. So start-stop method is fine. The patient isn't complaining of any pain, and it's not swelling, so the IV is patent. Alright. And then we'll again alcohol. Take hook up my IV bag, and I'm going to do the order is for 17 drops a minute, so I would take and I would slowly let this clamp go until it starts dripping in the chamber, and then I would time for 17 drops a minute. Alright, that looks about right. I'm going to assess the patient for any kind of reactions, see if he's having any adverse reactions or allergic reactions to it, and he's not. And then I would wait, come back in 30 minutes when the IV is done. So after the IV is done, I come in and I'm making sure, checking in periodically in between the 30 minutes. So when I get in and the IV is done, I'm going to double check any irritation of the skin. The patient is still, he's not had any adverse reactions to it, no anaphylaxis. So what I would do is I would clamp the IV all the way so nothing's coming out. And then I would have another 6 mLs of solution, saline, normal saline, to come in. I would take off the IV line. I would wipe the port with alcohol. I would aspirate for blood return. Then I would aspirate for blood return. Then I would push using the push stop method. If the patient had a port at this time, I would flush with saline, and then after I would flush with heparin, but only with patients with a port or a PICC line or a central line. Alright, I would take my gloves off, wash my hands, and I would document on the computer that the patient tolerated the medication well, it was administered in the proper amount of time, what was administered, how much, and any allergic or adverse reactions. Thank you.